Good morning. This is product attorney Jason Oakes, and this is your Wyoming Health Watch. It's the beginning of November 2019, and I want to thank everybody who has emailed me and communicated with me via the WyomingHealthWatch.com website. It's been very successful this past month, and I'm so glad it's providing value and interest and also safety information to so many Wyomingites and beyond. I'm interested to speak about a new issue today. This is the most recent issue that we have become aware of through you, and I want to thank one of our listeners for sending me some information on the topic today. It is of great concern for anyone who has infants or small children at home, and it is one that caught our attention immediately. And this is with regards to CVS and Hyland's pharmacy homeopathic teething tablets. These teething tablets are you've seen them if you've had small children. They can be purchased at most retail pharmacies like CVS, even Walgreens. And these are tablets that are marketed to parents to soothe babies' teething pains that they're having, obviously, when teeth are coming in. The issue, though, that is most concerning are the reports that have come about to the FDA as a result of what is believed to be a link between these teething tablets and a seizure disorder. There have been, as of this morning, over 400 adverse events that have been reported to the FDA as a result of use of teething tablets that have resulted in the seizure disorder. Frighteningly, some of these reports have even indicated that the seizure disorder, at least right now, is believed to be permanent in these small children, which requires a whole host of new medications then to come on board in order to manage what is now a new seizure disorder in these small children. I can't imagine going through this as a parent, but nonetheless, that's why we're here to provide more information and get info out to all of you about these tablets. I urge you to share this podcast with anybody who has small infants right now, because teething is an issue for those of us who had small kids. You're going to go through it. Your kid's going to go through it, and it's natural. There's nothing unusual about it. The FDA has already warned that these tablets should not be used. They should not be purchased. And they've also interviewed a number of doctors whose recommendations are there are many other soothing ways to treat an infant who is teething that doesn't require purchasing these teething tablets. So number one, I think important to know about these teething tablets is they are not FDA approved. And that is critical because FDA approval is a stamp that indicates that they have gone through rigorous testing, and that testing has been reviewed by independent individuals at the FDA who have concluded that whatever it is being submitted to them is accurate and otherwise safe for consumer use. And that brings up a whole nother line of questions and issues about how we're getting products on the shelf that you give to an infant via their, having to ingest it, that has not even been approved for safety through our US FDA. But in any event, I'll leave that to a different podcast, because right now we're focused on the issues surrounding the seizure disorder with teething tablets. I did go online this morning just to look at CVS.com to see if they still have them available, and they do. The other issue is they're marketed as homeopathic, which is kind of like an argument that they're natural, and that brings me additional concern, because as a parent who's trying to take extra special care of their little child, one would think that they're doing a very good thing by buying a quote all natural unquote product for their child. And yet there's right now very little that has been approved, or not approved, but very little that has been submitted to the FDA to even confirm that this product is all natural. This is being watched very closely by us. It's being watched very closely by the FDA. But the reality is, do not use these teething tablets as long as they are available to parents across the country. We don't have many CVSs. I'm not sure if we have any CVSs in Wyoming, but there certainly are CVSs in Colorado and states that surround us. There are CVSs all over the country, and many of these products are sold under the brand name label of the pharmacy that's selling it. So just because I haven't mentioned Walgreens, which is typically what you find in terms of pharmacies in Wyoming, Don't be fooled if it has a Walgreens stamp on it. None of these teething tablets, regardless of who the brand name manufacturer or distributor is, have been approved and or even evaluated by our U.S. FDA. If you know somebody who has had an issue with these teething tablets, even if it's not regards to seizures, you can report this to the FDA. You can go on the FDA's website. It's fda.gov/medwatch, MEDWATCH/report. Okay, fda.gov/medwatch/report. And that's where you can go on the FDA's website and report any sort of adverse events, which is critical because most of the research that I've seen, regardless of the product or regardless of the issue, the average number of people who actually report concerns and adverse reports and adverse events are believed to be somewhere in the order of 10%. So if that is a number we believe to be true, then if 400 or so reports have been made to the FDA thus far about these teething tablets, you can extrapolate that to mean that it's a much larger issue concerning anywhere between 4,000 and even north of 4,000. So thank you for listening. We are watching this very closely. This is a horrendous issue to be dealing with if you are a new mother, a new father. Stay away from the teething tablets until we know more. Please share this podcast with anybody who is either pregnant or has a small child so we can prevent harm from happening. Thank you so much for listening. Again, I'm Jason Oakes. This is your Wyoming Health Watch. And if you want to listen to this again or you want to look at any other information we have tried to disseminate among people in Wyoming and elsewhere, please go to wyominghealthwatch.com. Have a great day.